For my service learning project, I volunteered at the Salem Memorial Flu Clinic on October 30th. We were there from 6:30 in the morning until 10:30. The clinic was set up in the entrance of the hospital, right when you walk in by the front desk. It was available at no cost to all of the hospital staff. We had a couple of patients walk up and try and get a vaccine, but we weren't able to give it to them. It was exclusively for the hospital staff. And so because it was just for the hospital staff, the adult population that we served they were obviously adults. These vaccines help protect everyone that all of the staff comes in contact with, and also themselves. So the patients at the hospital, their families at home, the people they see at the grocery store. Vaccines create herd immunity, which protects everyone, not just the people that get the vaccines. So in a way, we were serving everyone in saline. We provided there were intramuscular injections in their deltoid. They had to fill out a verification form after so that they could keep it for their records, because these were mandatory. They have to be on file, so they would sign it, we would sign it, we would have to put the batch number from the vaccine on the paper. The social determinant of health that we addressed, I believe, is healthcare access, because not just clinical staff were required to have the vaccine, it was everyone. Janitors, cafeteria workers, front desk, receptionists, everyone. And just because you work in a hospital doesn't mean that you have great access to personal primary care. And this way, everyone at the hospital, clinical staff or not, had access to preventative care that kept them and their families safe. There are a couple of other ways they could get access to healthcare outside of that, such as they could go to the public health department, or there's even the 211 hotline, which I just learned about. It's a national hotline that gets you in contact with all kinds of resources like healthcare, food, transportation, helping you pay bills. It's just like a nonprofit for everyone hotline. I feel like we made a really big impact. There was four of us at the clinic. We were each able to do over 6 injections each. I think a couple of us did a little bit more. That's over 20 people that we helped immunize against the flu, and that helps break the cycle of infection inside and outside of the hospital. My biggest takeaway is that not everyone knows or understands why vaccines are important, and it's our job as healthcare professionals to educate them at a level that makes sense to them so that they can take that information and do what they need to do with it.